how do I get ready for my nurse IVF coordination? Because they schedule the appointment and then there's a period of time before the appointment. What can they do to really make good use of that time?
So in the time that our patients are waiting for their coordination visit, we do encourage them to stay active in their portal. Make sure they review the Welcome IVF letter, because that Welcome IVF letter contains very valuable information, gives them kind of a little checklist of things that need to be completed before they can actually embark on an IVF cycle. We also will be loading video modules and consents for treatment through our education platform known as Engaged MD. So they will need to be aware of their regular email, looking for the link to be able to access those videos, as well as the consent process. During the time that you're waiting for your coordination visit, it's also very important for you to connect with financial. At your visit, you'll get some initial contact information for financial, but you also need to make sure that you've connected with them so that you can begin working on an authorization if that's required from your insurance. And if it's not required by your insurance, you can then be aware of what your out-of-pocket expenses will be. So during that time of what feels like an eternity from the time you have your next steps visit with your provider while you're waiting for your coordination visit, there are many things that can be completed during that time, to include your lab work, your day 3 labs if you need authorization, your video modules, your consents, reviewing the Welcome IVF letter. And as you review all of those steps, if questions come up along the way, certainly feel free to ask us through the patient portal. If it's a question that we feel like you need to have a sit down with the provider, we'll encourage you to schedule a telehealth with your provider.
And I think people learn differently, and so we're really trying to have written resources, videos, interactive sessions in telehealth, so that by the time you're starting your IVF cycle, it feels familiar and therefore less stressful.